blood that's going through the upper limbs is going to first begin at the subclavian arteries. Remember, these branch off of the basically the brachiocephalic trunk, and that subclavian artery is going to pass to the armpit area, the axilla, to become the axillary artery. That axillary artery then is what supplies the shoulder and thoracic region, and it passes then to the upper arm where it becomes the brachial artery. And that brachial artery then is going to split at the elbow area, bifurcate into the ulna and the radial artery. So on this diagram, we can see both the arteries as well as the veins in the upper limb. So for the arteries, they begin as the subclavian artery leading to the axillary artery in the armpit, the axilla. It continues into the upper arm, where it's now referred to as the brachial artery. That brachial artery then bifurcates at the elbow to become the radial artery and the ulnar artery. So now the nutrients and the oxygen are delivered to tissues from capillaries in any of these regions. So now a vein is going to be returning that deoxygenated blood as well as waste products from those tissue areas eventually back to the right side of the heart. So the radial vein and the ulnar vein are going to lead into the brachial vein. We also see the median cubital vein here. The median cubital vein is a common vein where they take blood out when you give blood. A vein that I want you to notice here is called the basilic vein. And the basilic vein is actually going to be on the median surface of the upper limb. And you can see that as it travels up here, it eventually leads to the axillary vein. Whereas another one of these veins in this area is called the cephalic vein. And the cephalic vein is going to be on the lateral side of the upper arm and joins the axillary vein to lead into the subclavian vein. So be sure that you could identify these and you know where they generally lead to. Like the basilic vein being on the medial surface of the upper arm and leading into the axillary vein. There's also, as far as the superficial venous drainage, would be ones that I have mentioned, like the basilic vein, which runs adjacent to the medial surface of the upper limb, and eventually ends up in the axillary vein, as well as the cephalic vein on the lateral side of the upper arm. At the median, or at the cubital fossa, which is the elbow, two veins are connected by the median cubital vein. The radial and ulnar veins are going to merge to become the brachial veins. The brachial veins then merge with the basilic vein to form the axillary vein. And that changes its name to become the subclavian vein when it is in the clavicle region. For the lower limb, the abdominal aorta is going to bifurcate into the common iliac arteries. That common iliac artery leads to the right and left iliac, which supplies blood to the lower limbs. Once the external iliac is now in the lower limb, it changes its name to the femoral artery, which provides a branch for the deep femoral artery. The rest of it continues to the knee, where it's called the popliteal artery. The popliteal artery supplies the knee joint, and it divides into the anterior and posterior tibial arteries, which would be in the lower leg, called the crural region. So this slide is showing that vascular supply of arteries to the lower limb, beginning with the common iliac artery. When it then splits, it becomes the internal iliac artery, and the external iliac artery. As it continues to descend, now that's in the thigh region, it's called the femoral artery. A branch of it is the deep femoral artery. That femoral artery then, once it gets to the posterior surface of the knee, is called the popliteal artery, which splits to become the anterior and posterior tibial arteries. We then see also the fibular artery, which is on the lateral side of the lower leg. For the vein drainage of the lower limb, the popliteal vein is now going to curve onto the anterior thigh compartment, and there it becomes the femoral vein. That femoral vein is going to pass as it goes back towards the heart. It becomes the external iliac vein, and that fuses with the internal vein to become the common iliac vein. And both those common iliac veins are going to merge to form the inferior vena cava, which we can see on this slide. So the great saphenous vein is one of the longest veins that we have in our body. In fact, when people get a coronary artery bypass, they need to bypass part of their coronary blood vessels, their coronary arteries. They'll actually take a section of the saphenous vein and use it to bypass the area that's damaged on a coronary artery. So the tibial veins are going to combine into the popliteal vein, which leads to the femoral vein. The femoral vein then is going to lead to the external iliac vein, common iliac vein, and then inferior vena cava.